Hi everyone, it's Leanne from Bradford Under Fives. I hope you're all well. Today I'm going to share some information with you guys on oral health. This information is often shared in parent and toddler groups, and it's really important because tooth decay is actually the most common disease to occur in children and young people in the UK. So it's really important that we try and share this information as far and as wide as possible. Tooth decay is something that happens gradually and really slowly over time, and in young children it starts when they are very, very young. And recent surveys show that by the time children reach 5 years old, so roughly reception age, nearly a quarter of those children already have tooth decay. So it's really important that we learn how to look after our children's teeth before it reaches that stage. Because the most worrying thing is that tooth decay is the most preventable disease. It can be the most painful thing to occur in a child. Might know yourself as adults if you've had toothache. Tooth decay can lead to multiple tooth extractions for children, and actually children who have been taken to hospital for their teeth taken out, 9 out of 10 of those cases are because of tooth decay. So it's really preventable, but it's really real and it's happening right now. So in the UK, we are really, really fortunate to have the NHS, and they offer free dental care for children in the UK. So the advice is, as soon as you have children, get them registered with a dentist. So it might be the case of that you might not actually be registered yourself, but a lot of dentists take on children before adults. So it's really, really important to get them registered and then to take them along. So if you're going to an appointment for yourself, take your baby along with you, and this helps them to get used to the environment, because sometimes dental surgeries can be quite scary places. They have lots of different noises going on and different smells. So for a really young child, it can be quite an anxious place. So by taking them along as babies, we are helping them to get used to the environment before they need to actually go themselves. So it's recommended that we start to brush our baby's teeth as soon as they start to arrive. So usually around 6 months old, babies will start to develop their teeth. And you might find it actually easier to begin to brush their teeth using a little cloth, first of all, or even a finger toothbrush. And it might help them to just get used to the motions of brushing the teeth. But it's recommended that we try and get them into the routine of brushing teeth twice a day, just like us. So that routine is firmly set in place, and it will help in the long run. When we're brushing our baby's teeth, they need to be using a fluoride toothpaste. So babies from 0 to 3, it's recommended that they use a toothpaste that's around 1000 ppm. So on the back of the toothpaste, it will give you the number. So it needs to be 1000 ppm, and that's the amount of fluoride that's in there. And then for children 3 and above, they can move on to 1350 or 1500 ppm, and that's around an adult's toothpaste. And that fluoride is going to leave the coating on the teeth to prevent a tooth decay. So other things that we can do to prevent tooth decay is what's recommended by our dentists is that by the time our baby's around 6 months old, so their first teeth are coming through, is that we try and move them from having a bottle to a free-flowing beaker or even a cup. And this is because the sucking on the teeth when the teeth is coming through can actually damage the teeth. So if we're offering our babies water, or even formula-fed babies who are being bottle-fed, it's recommended that they get used to having their milk in a free-flowing cup, rather than the ones with the valves on that you have to really, really suck on. So basically, if you have a cup and you tip it upside down, it's going to really pour out. So it'll make the most mess. But for our teeth, it's the one that's recommended to use. It's the safest. Other things that can affect and cause tooth decay is sugary snacks and sugary drinks. So it's actually recommended for children in the UK, age 0 to 5, to only be offered milk or water. Quite often people think that fruit juices are a healthy option, but in actual fact they are really, really sugary, and they also have acid in, which can affect the enamel on the teeth. So it's really important that we try to avoid these things. Our teeth can sustain 4 sugar attacks during the day. So if we think about the meals that we have breakfast, dinner and tea. It doesn't really leave any room for anything else. So if we are wanting to offer sugary foods, sugary snacks or sugary drinks, it's recommended that we really, really water the drinks down, so make sure they're really diluted, and offer them at those meal times, just to reduce the amount of sugar attacks that our teeth are going to have during the day. And this will really, really help look after your children's teeth. Stay tuned this week, because I'm going to be sharing lots more information on looking after our children's teeth, especially during this time in lockdown when we can't be really visiting the dentist. If you've got any questions or anything like that, feel free to leave comments on this video, or you can privately message us at Bradford Under 5s Association, or you can look on the NHS website for any other help and advice for children's teeth.